I think the whole concept of immunotherapy in the prostate cancer world is evolving. Obviously, immunotherapy has caught everybody's attention across the United States, but what most people don't realize is that there are actually different forms of immunotherapy. But when we look specifically at prostate cancer and what's available that's approved and reimbursed for advanced prostate cancer patients, it really comes down to one, which is Sipuleucel-T or Provenge. Provenge was approved by the FDA for the management of patients with metastatic castration-resistant prostate cancer. So what we mean by that, so by definition, these are advanced patients who have been diagnosed with prostate cancer, are currently receiving hormonal therapy, which for the most part it includes androgen deprivation therapy vis-a-vis LHRH therapy. Their PSAs are going up. Their testosterone levels are in the castration range, usually less than 50 by definition, and they have to have evidence of radiographic metastases either on bone scan or CT scan. As much as we would love to have this therapy available to all groups, that's currently the only place where, as your urologist, we can actually use the drug. So that's kind of the first thing that we have to understand, is that Sipuleucel-T is the only immunotherapy that is approved for advanced prostate cancer. Now, with that being said, the unique thing about Sipuleucel-T, which is entirely different from any of the other therapies, what we call the immuno-oncologics, is that though the other immunotherapies that are now currently being used in lung, colon, melanoma, now bladder, are all manipulating the patient's immune system and releasing the brake off the system, if you will. So they are specifically looking at what we call checkpoint inhibitors, and what we mean by that is that the immune system has a brake to it. It cannot just go on and on. You know, we all know about what we call autoimmune disease, and the autoimmune diseases, like rheumatoid arthritis, is that the immune system is going unchecked. So in the normal functioning immune system, there is a check to the system, a brake to the system. So that's what these checkpoint proteins, CTLA4, PD-L1, they are the brakes to the system. So in the ones that you hear about that are not being used in prostate, these are what we call these checkpoint inhibitors. They're releasing the brake. Sipuleucel-T or Provenge is very different. It's an autologous immunotherapy where we are actually harvesting the patient's own, what we call antigen-presenting cells, incubating those cells outside the body, exposing those cells to a protein that's specifically on the prostate cancer cells, prostatic acid phosphatase. Then once the patient's own cells are basically stimulated, we give those cells back to the patient. It's 3 cycles, it's 2 weeks apart. It's been approved in the United States, and it's only available in the United States since April of 2010. A lot of the urologists around the United States are using them, but that is a very different type of immunological therapy than what's out there for other disease states. But again, I think people need to recognize, as much as we would want to use it in everybody, it really only is approved for patients with metastatic castration-resistant prostate cancer.